Hi, this is Dr. Turas Tagayuna, and I will be your faculty for this lecture on the practice of medicine under our legal medicine. The practice of medicine is a privilege or franchise granted by the state to any person to perform medical acts upon compliance with the law. This includes judging the nature, character, and symptoms of a disease in determining the proper remedy to the disease. It also means the diagnosis and application and the use of medicine and drugs for curing, mitigating, or relieving bodily diseases or conditions. What constitutes the practice of medicine? Any person who, for compensation, fee, salary, or reward paid to him, physically examine, diagnose, treat, operate, or prescribe any remedy for human disease, injury, deformity, or any ailment, administered, prescribed, and recommended. Any person who shall, by means of signs, cards, ads, written or printed, or through TV, radio, or any means of communication, either offer or undertake by any means or method to diagnose, treat, operate, or prescribe any remedy for any human disease or injury, and any person who shall falsely use the title MD after his name. We would like to define some terms that we use in the practice of medicine. And one is diagnosis, and this is the act of making a judgment and would appear to rest solely within the scope of medical and not nursing practice. Treatment, all steps taken to effect a cure for an injury or disease, and it includes examination and diagnosis as well as application of remedies. Operation is an act or succession of acts performed upon the body of the patient for his relief or restoration of normal condition, either by manipulation or the use of surgical instruments, or both. And prescription is a direction of remedy or remedies for a disease and the manner of using them. A formula for the preparation of a drug and the medicine is also used. There are acts that are not considered to be a practice of medicine. One, now, who are qualified to practice medicine in the Philippines? Those who have complied with the prerequisites to the practice of medicine in accordance with the Medical Act. Those who can have limited practice even without any certificate of registration. These are the physicians and surgeons from other countries in consultation only. They cannot really fully practice medicine here. Limit their practice in their specific work and with previous authorization from the Board of Medicine. Those commissioned officers of the United States Air Force that are stationed in the Philippines, and maybe foreign physicians employed as exchange professors in special branches of medicine and surgery, and medical students who have completed the first 4 years of the medical course, graduates of medicine, or registered nurses during epidemics with approval from the Secretary of Health, like what has happened here during the COVID pandemic, except that, of course, we don't want you also exposed to the pandemic. Who are these balikbayan physicians? PD 541 allows former Filipino professionals to practice their respective professions in the Philippines with certain provisions. These foreign physicians are qualified by reciprocity or by endorsement. Reciprocity: if the Filipino MD is allowed to practice medicine in a foreign country, then we may also allow physicians from that country to practice here in the Philippines with certain provisions. There are limited practitioners of the healing art, and those governed by certain laws, such as those of the dentist, optometrist, midwife, nurses, medtech, physical therapists, and occupational therapists, and the pharmacists. And there are those limited practitioners of the healing art without specific licensure laws. And you have a list here: the chiropodist that treats diseases or malformations of the hands and the feet, the chiropractor that treats diseases by manipulating the spinal cord, the masseur or the masseuse, the naturopathist or the naturopathy, and the napropathist who manipulates the ligaments. You have the neuropathist and the osteopathist, the manipulative correction of the bony framework of the body. As the scope of the practice, we have of medicine, we have general practice and specialist practice. As to the venue of the practice, it can be a clinic practice or a hospital practice. As to the number, individual practice or group practice, and the group practice may be may have an employer-employee relationship, or it can be a or just a plain partnership. So this is the practice of medicine, the classification of the medical practice. The forms of group practice can be employer-employee, as we mentioned earlier, and they can be partnership, corporation, and then it can be contract practice, where the practice or medicine is under an agreement. You practice an industrial medicine, or else you can have a medical service plan. This is a form of agreement or arrangement of prepaid medical care. Thank you very much for your kind attention. Medical student like you enrolled in an approved college or school or graduate under training without professional fee provided he renders service under the direct supervision of a registered physician. So you are not practicing medicine. Legally registered dentist engaged exclusively in the practice of dentistry. A registered masseur or physiotherapist under written order of a duly registered physician, a registered optometrist, or any person rendering services for free in an emergency case or in emergency cases or in places where there is no available services from duly registered physician. And any person who administers, recommends household remedies per existing pharmacy laws, and any clinical psychologist with supervision from a doctor, or a prosthetist under supervision from a physician. These are acts that are not considered to be a practice of medicine.